So we're back, and now let's talk a tiny bit about access, like I mentioned. So, one of the things that I think is really important is that, and actually, a phenomenal thing happened. So, here at FDRS this year, we have had the most number of attendees, and within that number of attendees, we have had more than 50% new people to the conference, and many of those are even providers of all different modalities. And with that, we had some new surgeons here, and we know that around the country there are people that are letting everyone know that they have some interest in and some skill within the lipedema reduction surgical world. Obviously, Dr. Wright is one of the, OGs and has, been all over the world this year. You've really, I mean, you've
Yeah,
been doing a lot this year, right? You've
yeah,
done a lot of research, you've done a lot of, speaking, you've done a lot of collaborations. Didn't you even go for some training
yeah,
in
yeah,
Germany?
yeah. So
Okay.
I'm
More training.
always learning, and
Yeah. Yeah.
I learn so much from my colleagues, and yeah,
Yeah.
and my
So
patients.
So for me, I think that that is integral. Like I think that when you're looking at, hey, how do I consider choosing a surgeon? So yeah, there are some directories out there. There are some, Facebook groups out there that you can, kind of get in the loop and see like who people are talking about. But as a person who's involved heavily in social media, I would say that you can't rely on that. You have to do your due diligence,
Right,
and you have to
right.
really look at like who the people are and what do they do and how do they how do they go about in the world other than what the obvious, right? And so to me, you're seeing somebody who is there, who's on the panels, who's there giving speeches, who's there reporting his findings from different research studies, who's you know taking different approaches, maybe isn't even doing the same thing as everybody else. For instance, like Dr. Wright does, basically, do I call it awake? Right?
Right,
Does
yeah,
awake procedures. And do you do 360 also?
yeah.
Okay, so 360 awake procedures in your own clinic,
That's right. Yeah,
right?
yeah. So we have a surgery center attached to our office, and but I want to say, like, this is Beth. This is so important, and if anybody learns one thing is, it is you have to do your due diligence. You don't just wanna pick it on some one person's recommendation,
No,
one
and you have to
person.
see a bunch of people first.
Right, right, and so you want to you want to feel a fit. You want to there's personalities. The personality of each surgeon and their practice differs, and you want to find a surgeon who you connect with, who you feel a trust with, who you can trust that they are going to treat you suc not only successfully but also as a person, and really be not just for a for a surgical procedure, but also comprehensively. So
Because you're going to be involved with them for a long time. Because not only does the surgeries generally take more than one, but they generally also take um, a lot of interaction with all of the people. So, in my opinion, you can't just be like, oh, hey, I like that surgeon. You got to be like, how does the whole team work, right? Because we certainly have heard lots of patients report that, like, oh, I love my surgeon, but their back office, I mean, there's lots of moving parts within the whole thing. You're going to be, dealing with, front office staff. You're going to be dealing with nursing staff. You're going to be dealing with pre-care people. You're going to be dealing with post-care people. You're going to be dealing, obviously, with the surgeon. You're going to be dealing with, hopefully, you're going to be dealing with somebody who has an insurance department that can help you navigate that aspect. Because, in my personal opinion, you should always be trying to secure insurance first, as a first thing. If that doesn't happen and you have the means otherwise, then by all, but you're not doing yourself or anybody else any favors by just being like, oh, I'm gonna, not worry about that because it just, we're in the infancy stages. We're getting things going with the insurance, and we need to make sure that we keep presenting that there is a need and this is a required surgery, which, as Dr. Wright is saying, is called lipedema reduction surgery. That's what it's called because you need the diseased tissue reduced in your body.
So there's so many points I want to touch on.
Well,
Okay, all right. So
Lay 'em out.
first of all,
What's the first one?
it is the whole team. I mean, I am very blessed and that I have a team that does so much care, does so much, and helps, all the coaching, phone calls, all that stuff. And we have a team that helps with insurance. And I think that's really important. I think in-house insurance help is critical because it, first of all, a physician should do this. This is part of our job, is to help our patients get coverage. And the other part is that no one's going to fight harder for your coverage except someone who's bonded with you, who has once
We both have an investment in
we
that.
both have an investment in it.
Sure.
So, but that said, not everybody. It's very important to understand that not everybody. Every insurance plan is not going to cover it, or not going to cover it very well. There's some that cover it well. There's some that are just absolutely impossible to work with, and you have to understand our current healthcare system, our current insurance third-party payer system is broken, and they have so much power in the relationship, and they often can really determine whether you get coverage. But we have
a fight, just like everything else.
It's a fight. We have a lot of success, but we don't have 100% success. So, goodness. So now,
Another one.
So let me talk about lipedema reduction surgery. So it should not be called liposuction. Liposuction is by definition a cosmetic procedure, okay? And we are treating a disease, and our goal of lipedema reduction surgery is functional improvement, decreased pain, improved mobility, improved quality of life. These things are critical and critical goals of the lipedema reduction surgery. Liposuction, as I said, is a cosmetic procedure. Its goal is cosmetic improvement, and the problem, it goes further, because if you calling it liposuction and using the name of a cosmetic procedure for it, then that gives the insurance companies a reason to deny it just because of the name, and then that's unfortunate. And so we need to make sure it's more and more people are adopting this term, and this is something I am excited to be part of. And this has been a passion of mine to change this term for some time.
And it's called LRS for short, lipedema reduction surgery. Now, speaking of that, improvements, didn't you do a paper this year that was about like the knee, the additional movement that you get in the knee when you reduce the volume with the surgery removal?
Exactly. So yes, I'm very proud of a paper Dr. Herbst and I and others